My name is Joel Graaff, and I am from Utah, grew up in Utah. I went to undergraduate at a small school in Utah called Weber State University in Ogden. From there, I went to the University of Utah for medical school. And after graduating medical school, I came out to University of Nebraska Medical Center for residency, where I did internal medicine and pediatrics. It was a combined program. From there, I went on to the University of Iowa to Allergy Immunology Fellowship. So I decided to go into allergy and immunology really because I enjoy working with patients of all ages. So I did my residency in internal medicine and pediatrics, and I wanted to continue to treat both children and adults, and allergy and immunology really allows you to do just that. And so sometimes I'll say, we get to treat patients from womb to tomb. And so we see the young newborns as well as older adults sometimes in the same day, and that can be really rewarding. I also really enjoy being able to make a difference in people's lives, and a patient comes in with allergies and they're suffering every day, and we can do some things that really help and improve quality of life, and that can be very rewarding. When I first sit down with a patient, I think it's really important to just sit back and listen to what the patient is saying. I think that's one of the most important things about being able to understand the problems that the patient comes in with, and then being able to address those issues. So when I first sit down with a patient, I'll just ask a very open-ended question about what brings you in today, and just allow them to kind of direct the narrative. From there, I'll ask a few more pointed questions, but I think the most important thing is being able to listen and to be able to have some empathy for the problems that patient might be going through. So I really like academic medicine because it gives us an opportunity to teach. And I think education and medical education is a very important part of being a doctor. My father was a college professor, and he instilled in me very young the importance of education. And in college, I briefly toyed with the idea of going on and getting a PhD and becoming a college professor myself. But being able to be in an academic institution and teach medical students and residents really kind of helps to fill that void that I have, where I want to be able to teach and participate in education.